Well, good evening, everyone, and welcome to the BioTouch Healing Health Condition Monthly Workshop Gathering. And today we're going to talk about autism. And hi, my name's Paul.
Oh, good evening. This is Bev.
Hi, Bev. And so we're going to share with you the BioTouch Healing Technique, the few sets of points that we can do to address autism. But we always start these workshops with a presenter. And tonight we have Angela Runyon, and we are just going to show the presentation she did in 2016. Can you believe that?
Crazy. We've been doing this workshop for
long time. 2016, yeah. So 9 years ago, and I asked Angela if there was was it okay? Did she need new information? And she just said, no, as far as the basics that we're going to share here in her presentation, she has now been teaching, she's speech-language pathologist for 25 years now, and she's still doing it. So definitely knows what she's talking about. So what we'll do is we'll share with you her presentation. If you'd like to stick around and learn the sets of points that can address autism, Bev's going to take us through that. Download the workbook for free right now at justtouch.com/workbook. It's free for 30 days from this date. Otherwise, it's free to members all the time. And we're going to listen to Angela and then come back and teach you a few sets of points. So here we go.
No, you guys all seem really nice. I'm afraid of the camera, and I don't love the idea of posting this on a website. But anyway, so my name's Angela Runyon, and I'm a speech-language pathologist. That's what I do, like, as my job. But I have this other really important job. I'm a mom, and I have a 5.5-year-old son named Lucas, who's come here for BioTouch, and I have an 8.5-year-old daughter named Annalise, who has also come here for BioTouch, and I may talk a little bit more about her later. But first, I'm going to start just talking a little bit about autism and a little bit about, I'm not going to talk about any of the new research right now, not necessarily. There's kind of a lot going on. I'm going to give more of a little bit of a broad picture of autism, a little bit of the changes that have come about since the diagnostic manual, the DSM-4, then became the DSM-5, diagnostic. I'm not sure what DSM stands for, but it's just the statistical manual that all psychologists and all mental health professionals use to diagnose any kind of mental health and other syndromes and diagnoses. So in DSM-4, there was autism, and there was Asperger's, and there was pervasive developmental disorder. And a lot of people thought that there was a really big difference between these things. And I think that as more kids got diagnosed and we learned so much more about autism, we realized that this is all just under one umbrella. And so when they rewrote the manual, and it just came out, I believe, last year, maybe the year before that, they just changed it to autism spectrum disorder. So now everything, autism, Asperger's, and pervasive developmental disorder, it's all called autism spectrum disorder. So, kids that are now getting diagnosed, they're diagnosed with ASD. You certainly can talk about having moderate ASD or severe ASD, and there are other diagnoses that can come along with autism. So you can have autism, and you could also have mild or moderate mental retardation. But these are kind of separate pieces, and so what they really wanted to focus on was what autism is. So one way to think about autism is a three-legged stool. And if one of these legs isn't there, then you don't have autism. That's just, I mean, that there's something else. So there's, it could be a pragmatic language problem, and pragmatic language is the social rules of language and things like that. And I have worked with some kids that really have just pragmatic language problems. So anyway, the 3 legs of the stool are restricted interests, communication problems, and problems with social interactions. So, if you only have problems with communication and you only have problems with social interactions, then it might be more of a pragmatic language disorder. You have to have that repetitive and restricted interest as well to be qualified as on the spectrum of autism. So, and all of these legs they look really different through the lifespan. So, a 3-year-old who has restricted interests may be lining up cars instead of playing with them, maybe opening and closing cabinet doors, repeatedly, things like that. But what that turns into as kids develop, and when and if they develop language and communication, then that could be a child that really only wants to talk about the Titanic. And all the stuff I talk about, these are all kids I worked with. So, I used to work with a kid, all he would talk about was that was it. So if you wanted to talk to him, and you could have a conversation about the Titanic, you could try really hard to veer off the topic and maybe talk about some related things, and sometimes that went okay. But as you can imagine, this gets to be really difficult when kids get older, preteen years, teen years, and beyond. It's really difficult to have such a restricted the amount of things that you're willing to talk about or discuss, and these kinds of things. So I think that the woman who asked what actually is autism, I think that that's maybe the easiest way to answer that, if you think of it as a 3-legged stool. And so all of the kids that I've known in my life, and I've known a lot, probably hundreds, they all have specific difficulties with all 3 of those areas. And so the communication piece, it can be all the way from children that are 18 months and they know their alphabet and they know their numbers and they're starting to teach themselves how to read, but they don't say mom. And when they want a glass of milk, they don't say want milk. They have a temper tantrum. And so, but that can go all the way towards, all the way to children that are completely nonverbal and they don't speak at all. And so I've worked with kids that use sign language to communicate. I've worked with kids that use pictures to communicate. I've worked with kids that have used communication devices to communicate. And if you're not familiar with that, an easy way to think about it is like an iPad that you touch symbols or buttons and it talks for you. And so, I think the other thing about autism, besides knowing about the 3 legs of the stool, is that when you have met one person with autism, you have met one person with autism. It is amazing the huge spectrum of differences that kids have. And so, I think that in some ways I understand that all these kids are lumped under this thing, but it's because of those 3 legs. Because otherwise you would look at these kids and be like, there's no way that these guys are, having the same difficulties or whatever, because it can look very, very different. I think that oftentimes when autism is portrayed in the media, movies, TV shows, which by the way have gotten a lot better than they used to. So I'd say maybe 10 years ago the way it was portrayed. I feel like they really focused a lot on sensory issues and kids waving their hands in front of their face and having specific sensory needs that they're trying to get met, and that absolutely can be a piece of it. but it has nothing to do with the diagnosis of autism. It's not, you don't check in the diagnostic manual, does the child wave a hand in front of, their face, or, does the child, is the child very sensitive to loud noises? And now there's a couple of kids at my daughter's school, and they wear headphones, because they are sensitive to loud noises. But that's not autism. Certainly there are lots of things that go along, that can go along with autism. They can co-occur, the sensory problems. And also, certainly as kids get older, a lot of anxiety. A lot of kids with autism, 9, 10, 11, 12, 19, they can have a lot of anxiety, social anxiety, because maybe they know that they're not good at it. Or maybe they're so confused by the whole experience, they don't really understand the social rules or the scripts. So, I worked with a kid. I lived in Sweden for 3 years, and I worked at an international school. And I worked with a really great little boy. I loved him so much. And his favorite time of the day was lunch, which in some ways can be kind of funny because, kids with autism, they struggle with the social aspect and whatever. And we would sit down and have these meetings. He actually had a one-on-one aide that was with him that I worked on training. And, the mom would come in and people from the commune would come in. We'd have these meetings and we'd be problem solving and talking about Runyon. His name was Runyon. Trying to figure out, what made him upset and what were the things that helped him be really successful. And one of the things we talked about is he really liked lunch because he really understood what he was supposed to do. He really got it. You get your plate and you go up to the person serving lunch, and you get the food and you say thank you, and then you get your drink and you go back to your table and you eat for a period of time. But then after he'd been sitting there just a few minutes, then he would get back up and he wanted to do the whole routine again because he understood it. He really got it. He was like, I know how to do this. I don't know how to play with kids. I'm not quite sure. I don't even understand really what circle time is and what I'm expected to do and what other people are going to do. It's all very kind of scary. And I think that sometimes, when parents or professionals or other people are trying to think about how to help kids with autism, try to put yourself in their shoes where you're just, you think about, in your day, you have so many interactions with people, and you understand. You understand exactly how to have these interactions. And you're always thinking about other people, and you're thinking about what they're thinking about. And, you know that they're going to say hi and ask you how you're doing, and then you're going to do that, and then you're probably going to go off to your meeting or whatever. It's all very, there's so many social scripts that we follow. We take it for granted that we know what to do. And a lot of these kids, they just don't know what to do. So, one thing that definitely can go along with kids with autism is anxiety. They just have a lot of anxiety. They don't know what to expect. They don't know what's going to happen next. They're not quite sure. Maybe they hate getting their teeth brushed, and they don't know if that's going to be going on forever. Are you going to be brushing my teeth for, how long is this going to go? Well, what if you sang the alphabet, when you were brushing your kids' teeth every night? And so they knew that it was only going to last this amount of time. And after time, would they struggle less? And, I just feel like working with kids with autism, it's so much trial and error and trying something out and, seeing how it works. Because a lot of the stuff that they struggle with, the social communication piece, the language piece, and having the restricted interests, it can make it very difficult to, know these kinds of social scripts and things like that. So I think I'm gonna stop talking about autism for a minute.
So there we go. She's that was just the first part of her talk, and too bad I can't find the rest of it. But so But you know what I really love about her presentation? She loved her kids.
I know, I can tell.
She loves what she does, you know,
Yeah,
and that
she
was
really
9
does.
years ago, and she's still doing it.
Still
Whenever
doing
she
it.
comes into the center to get worked on, she just loves her job. I mean, it's amazing. So before we teach the points, I wanted to build on some things she said because Bev and I we just saw this on Instagram with a Dr. Zach Bush, and we've been following him for a while. He really is an amazing doctor, professional in 3 different fields. And he talked about autism. I remember seeing a talk by his once, but I wanted to give you a little bit of how he sort of built on what Angela said. He said, autistic children are engulfed in the full quantum experience, the real multidimensional space around us, seeing all layers of humanity and its patterns of behavior. These kids experience life beyond the 5 senses, which can be overwhelming to their human brains. Yeah, interesting. And
No.
I won't read the rest, but I will read his last paragraph because it builds right into you going to teach the sets of points to help with this situation. For those touched by an autistic child, trust that you're getting a glimpse into a vast and sacred space. When your child looks most affected by their autism, perhaps it's when they are most connected to the entire quantum field, here to heal the whole human journey.
Oh, oh boy. That's
So,
very, very profound, is it not?
oh,
Because I've often thought that children with autism, ASD, they are, who's to say that they aren't the ones who are getting it right?
right.
The rest of us don't get it.
So we're going to teach you a few sets of points. Bev is here. And, you know, what we want you to know is we're not here to cure autism, but it
No.
certainly gives us something that we can do to help us cope with the person with autism and possibly help them to calm down in an anxiety situation. And I'll just give you one example. I worked with a young girl. She maybe was 5, 6 years old, was diagnosed autism, and she'd come into the room. She had these big glasses, you know, and couldn't sit on the table for 5 seconds, and would get up and then go and pull on the curtains and just, you know, just jumping around, all the different symptoms that Angela was talking about. And the first time I worked with her, I could only do seconds. I could barely get the greeting in, and barely was able to touch. I couldn't touch her on her eye at all. You know, she would just push me away and stuff. It wasn't even a month later, and I think she came in at least once a week. After about 4 or 5 weeks, she was able to sit on that table for 4 or 5 minutes, and I was actually able to start doing the eye set on her. That she
Wow.
was able to sit there so it's incredibly effective, and we're going to teach you the points here. So we're going to have Bev teach the points, and I'm going to be Mr. Techie in the background.
Okay. Okay. So as Paul mentioned, for those of you who are with us, you can download the workbook if you haven't already done so, and just follow along with us. So let's look at the workbook itself, and you will notice it's pretty standard. We pretty much keep it very simple. The very first page is always the information on the disorder, the condition that we are going to present. So it just kind of gives you a segue into some information about it so that you're kind of familiar with it. Where we're going to start then is that next page. It's page 6. And this is where we're going to introduce, for those of you who are the first time with us, what is BioTouch? And for those of you who are with us regularly, it doesn't hurt to just remind ourselves about this amazing technique. So basically, BioTouch is a very simple hands-on technique using the first 2 fingers of your hands to lightly touch on the skin. In fact, the definition of BioTouch is one person touching another person lightly on the skin, like a butterfly. The reason that it might work for children with autism is because it's not threatening. It's not invasive. That light touch just speaks love. And let's face it, that's the language that can get through to anything. So let's look at those 4 bullets so that we kind of remind ourselves. BioTouch is easy to learn. Even children can practice it effectively. And we know this for a fact. We have had children in our classes, and where else would we want to start? Those children working with their parents and their grandparents and their siblings. And they're immediately effective, as you will find out. BioTouch is a complement to any healthcare program. So in other words, you can use BioTouch to enhance anything else you may be doing, a special diet. Maybe you're on prescriptions, maybe you're doing other modalities, but you can use BioTouch to just help along that healing journey. It's wonderful. BioTouch has no levels. Everyone is effective. That's quite a statement, but it's true. The moment that you learn the technique, you have it. And the moment that you touch another person, you are going to be effective immediately. That's just the way BioTouch is. And it's because BioTouch is meant for us, all of us. We all have the ability already within us to practice BioTouch and to help each other. BioTouch requires no special preparation, belief, or state of mind. So you don't have to prepare yourself or the room, or you don't have to be worried about getting somebody's negative energy. BioTouch is love. That breaks down everything. Your state of mind, your belief system. No, your belief system can be whatever it is. It's not going to be in the way of you practicing BioTouch and helping someone. Your state of mind, same thing. We just can step up to another human being and touch them and help them with their pain and their stress. Very effective. So let's go over just a few little rules. We don't have many, but here we go. So we always advise wash your hands before you begin a session. Again, BioTouch is one person touching another person. We want to begin every session with the greeting, which is the first set we're going to teach. You're using the first 2 fingers of both hands and you're lightly touching on the skin like a butterfly. So within the sets of points, each point is going to be held for 6 to 8 seconds. BioTouch can be practiced anywhere with anyone, anytime. That's the way it is set up. So let's move to the next page. It's terms used in this manual. We're not going to go over the terms, but we do want to bring to your attention the first 2 bullets. That, if I haven't said so before, BioTouch is a relationship of healing. One person touching another person, 2 people having something in common. The one that is performing the points, doing BioTouch, is called the associate. And we call the associate, it's just as a definition in the dictionary, it's one often in company with another, implying an intimacy or equality. That's a very important thing to remember about BioTouch. It brings 2 people into an equality. That's a true relationship. It has the power to do that. And 2, one having an interest in common with another. The one receiving BioTouch is called the recipient. So we have the associate and the recipient in a healing relationship with each other. So we wanted to just clarify that. Those are the 2 people involved. So before we go to the first set, Paul, why don't you just kind of explain how this works?
Okay, so each set that you're going to see has 2 pages. One is this drawing, okay, and it has dots on it with numbers, and those will be the points that we'll be showing you how to do. Okay, and the second page will be a photograph, and there'll be words that tell you exactly where to find those points, okay? Now you'll notice at the bottom of each of those pages is a purple click here to watch video. And when you click on that, it takes you to the video which we'll be watching tonight to show you somebody doing the points and at the same time telling you where the points are, and the words in the video are exactly the same as the words that are in the manual.
That's correct. Okay, thank you, Paul. So we're going to begin with the first set. Remember, I said before you begin practicing BioTouch and doing any other parts of the body, we always want to begin with the greeting. This is seriously the key that opens the body, and it establishes that relationship between the associate and the recipient. As you're going to see, and it will say in the video, I'll just go over it with you real quick. This is the only set of points that you're only going to be using one hand, and especially your dominant hand for both. There's, as you can see in the diagram, there's only 2 points, point 1, point 2. So it's not very much. So you're going to be using the same 2 fingers on the same hand when you touch those 2 points. That's really the only set that's going to use one hand. So without further ado, let's go ahead and watch the video of the greeting.
And the key, I'm going to bring that up this time, I haven't in the past. You know, as they're showing it, practice them on yourself. Just find them on yourself. All these points you can access on your own. So as you watch it, see if you can find them on yourself too.
Absolutely.
The greeting is always performed at the beginning of each session. It's the only set that uses one hand and the only set that indicates which hand to use. The greeting is performed with the dominant hand. If you are right-handed, use your right hand. If you are left-handed, use your left hand. The greeting is made by touching at point 1, which is in the fleshy area just below the bottom of the breastbone or sternum. Hold this point for 6 to 8 seconds. Then, with the same 2 fingers, touch point 2 on the back. To find point 2, look for the big bone at the base of the neck. From here, move 1 to 1.5 inches to the left. This is point 2. Hold this point for 6 to 8 seconds. More than one associate may work with a recipient provided that all of the associates perform the greeting. If the associate or the recipient leaves the session, or if someone who hasn't done the greeting touches either the recipient or the associate, the greeting must be reestablished. Then the session may proceed from where it was interrupted.
Okay, the next set that we are going to teach is called the headset. And of course, this is perfect for autism because this set is used to address any condition related to the brain. And I might add, it is so calming as well. So this is the one you really want to start with after the greeting. So let's go ahead and watch the video of the headset.
The headset can be used to address conditions related to the brain. There are 4 steps in this set. In step 1, use through fire to touch points A and A. Point A on the back of the head is in the center of the neck at the base of the skull. Point A on the front of the head is at the center of the forehead where the forehead begins to curve to the crown. Step 2 is performed in crossfire with the fingers of each hand touching on opposite sides of the head. Hold at X, which is in the indentation beside the neck muscle at the base of the skull. It is the same as point 1 of the back set. On the opposite side of the head, touch points 1 through 5. Points 1, 2, and 3 are on the ridge line formed where the skull curves up toward the crown. Point 1 is above the outside corner of the eye on the ridge. Point 2 is above the front of the ear on the ridge. Point 3 is above the back of the ear on the ridge. To locate point 4, move down the head toward the base of the skull to a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear. Point 5 is opposite hold point X at the base of the skull. Point 5 now becomes the new hold point as points 1 through 5 are touched on the opposite side of the head. In crossfire, touch point 1 above the outside corner of the eye on the ridge, point 2 above the front of the ear on the ridge, point 3 is above the back of the ear on the ridge, point 4 is a horizontal indentation approximately 1/3 of the way down from the top of the ear and 1 to 1.5 inches behind the back edge of the ear, and point 5 is opposite hold point X at the base of the skull. Step 3 is performed in matching fire, touching points 1 and 1, two and 2, three and 3, 4 and 4, 5 and 5. Finally, in step 4, place the open palms of both hands on the head covering points 1 through 3. Be careful, don't let your hands touch each other.
Okay. Next, we have the neck set, and one of the reasons that we use this is because those nerves that go into the brain are located, if you look at that diamond, it's the kind of the source of those nerves. So you're actually following that path of those nerves that can go into the brain and help with autism in that way. So you want to add that to it as well. So let's go ahead. It's very simple set, but very effective. So let's watch the video.
The neck set is used for addressing most headaches, neck pains, and soreness of the upper back. These points are performed in matching fire on the large muscles that run along the back of the neck. Points 1 and 1 are halfway down the neck on the side of the large muscles. Points 2 and 2 are at the top of the neck on the side of the large muscles at the base of the skull. Points 3 and 3 are at the bottom of the neck on the side of the large muscles. As with any set, you may repeat the points as many times as you like. These points may be touched in any order, such as touching points 2, then points 1, and finally points 3.
The last set is the metabolism. And this is really an amazing set because it just helps the body overall. It helps it assimilate what it knows it wants and help get rid of what it doesn't want. So this is a real good one to use as well. Let's go ahead and watch the video.
The metabolism set can be used to help the body assimilate what it needs and eliminate what it doesn't need. The metabolism set has 2 steps. Step 1 involves touching points in matching fire along the large muscles on the front of the neck. Points 1 and 1 are located above the collarbone in the soft indentations on both sides of the notch at the top of the breastbone. Points 2 and 2 are halfway up the neck on the front of the large muscles. Points 3 and 3 are at the top of the neck on the front of the large muscles. The second step involves holding a point on the front of the body and touching points next to the spine on the back. Hold point X on the front of the body is on a line directly between where the nipples would be on a youth and is 1 to 2 inches to the left of the breastbone. Another way to find X is 1/3 of the way up the breastbone from greeting point 1 and 1 to 2 inches to the left of the breastbone. The points on the back are located next to the spine, forming a rectangle around the breakover point. The breakover point is where the bottom of the rib cage joins the spine and can be found by imagining a line directly through the body from greeting point 1. To perform step 2, find hold point X on the front of the body and touch points 1 through 4 on the back. Point 1 is approximately 1 to 2 inches up from the breakover point on the left spine muscle. Point 2 is directly across from point 1 on the right spine muscle. Point 3 is 2 to 3 inches below the breakover point on the right spine muscle. Point 4 is used to address blood sugar problems and is added to the other metabolism points when needed. It is located across from point 3 on the left spine muscle.
Okay. There we have it.
There we have it.
Doesn't get much simpler than that, folks.
No, and you've really started to help these kids. And as we always know, it gives us as parents or grandparents or just any adult, it gives us something that we can contribute
Right.
to their journey, that we can do for them.
So remember, if you have any questions at all with anything we've presented or you want some personal help with it, please reach out to us, office@justtouch.com. We have no problem. We have plenty of people that can meet with you on a Zoom or go over some of the points. The other part of it is you don't have to do all those. If all you do is the greeting, like I said, and I only got a few seconds in with that young girl, then do whatever you can. And then you can also just do some local kind of work, that touching kind of thing, just sort of, once you've done that greeting, it's almost like no matter where you touch, the body's going to eat it up. Like we've talked about on our Monday shows, the body knows what it needs and figures it out, especially with these folks, because it's not necessarily just children who are living in the full quantum experience, as Dr. Bush says.
Yeah. Wow. That's a great thought.
Yeah.
I really like that. Yeah.
I really do too. So use BioTouch in this quantum field and use it for other kinds of conditions. We have all kinds of conditions on our website. If you'd like a condition for us to do a workshop on, please let us know and we'll set one up here.
Absolutely.
Thank you, Bev.
Thank you, Paul.
And thank you all. The fourth Thursday of every month we do these workshops, and we'll see you all next month. Take care, everybody.
Bye.